Hey everybody, it's Dr. Sandy, and there are some things that I wanted to make sure that, there's a lot of things happening out in the world, and especially with those that are hurting. And I've had some people come forward that wanted to talk a little bit about, well, what is that opioid stuff that you're talking about, that withdrawal protocol, and how, and also the alcohol withdrawal, how does that fit into my normal health assessment? So I wanted to talk about a few things first before we jump into that. Again, I want to thank you. I am Sandy Risoldi, Dr. Sandra Risoldi, and the founder of Nurses Against Violence Unite. And now we're going to be launching our new venture, which I'm super excited about. And that is going to be for assistance for administration and all of those organizations out there that are looking for that prevention program that we have. So I'm so excited. This is a little tiny portion of it, and I'm so excited to be able to share this with you. So with all of this research that I've done throughout my entire stint for my doctoral program and the launch of Nurses Against Violence, and now it's a registered trademark and all that fun stuff, now I'm able to get really into everything with you in reference to how to stop violence in healthcare. So a lot of this stuff might be like, no, here we go again. Oh Lord, okay, you're preaching to the choir, Risoldi. It's out there, it's a problem, and I wanted to kind of give you a visual of exactly how how detrimental it is, especially with nurses that are hurting, the patients that are hurting, the CNAs that are hurting, and COVID and everything all jumbled up in just this one big gigantic blob. And we have to understand that nursing, mental health and nursing is like together, right? Because we are the ones that see the patient, we're the ones that assess the patient, we're the very, very front line, as well as also our CNAs that are seeing this patient as soon as they either come in the door or when they wake up from being, pretty much, given a medication to help them sleep down in the ER. They wake up, and what do the med surg nurses, they get the full brunt of this patient waking up like, and then we're drawing. This is a problem. And this is how violence is becoming out of control on the units. So what I want to do is I want to jump into a few things and explain visually how all of this and what I'm saying, there's validity to it. So let me see if I can figure out how to, let me see if I could share my screen. So, all right, share my screen, and oh, there I am. All right, so let me bring this over. And you can't, because I got to minimize this. All right, yes, I'm still kind of new at this technology stuff. So what I wanted to get into, and I have my other computer right here, is I wanted to give you the clinical presentation of the things that you're seeing out there, and just not understanding exactly what it is you're seeing. All right, so what we have here is clinical presentation, spotting withdrawals, both opioids and alcohol/benzos. Okay, so there's not only lab things that you're going to be looking for, but this is something that if you don't know this and you know that there's something wrong with your patient, you need to tune in, because this patient is going to either become violent or they're going to be really hurting. So let me go ahead and raise my little platform. This will be a little easier for me. Sorry, I'm a little bit. There we go. All right, so when we have this patient that's coming in and they're, they're withdrawing and, or they're waking up and they're starting to get really angry and starting to not so much seem like they're being very nice. Either they're funny, sarcastic, and then that starts to turn into some mood disorder, and we can talk about that another time. But this person's not acting very kind. They might be kind and they might be overly kind, like, you're the best nurse I've ever had, and all this other fun stuff. So want to make sure that you're getting clued in on some of the behaviors to try to get more medications. And this presentation of this patient, there's a couple different things they're going to look out for. So the first thing that I want to talk to you about and back up a little bit is homelessness in America. We have a problem. We also have a problem with issues with COVID, the fear of the unknown. The things that are happening out there is not good at all. We have in the latest statistics that are out there in 2020, roughly 580,466 people were homeless on any given night in 2020. Okay, so we also have COVID kicking into full gear in 2020. People are scared. People are not doing okay. And nurses, these people are coming in for shelter, or it's not just homeless, guys, but I'm just giving you one tiny picture of this puzzle. Okay, you have people that are coming in that are hurting, that don't know which way they're gonna get their next meal. They're using their resources, and they're coming into the hospital system. And that's okay. But here's the thing: there's a lot of employers out there that recognize this, but they don't know exactly how to take care of these patients. Well, we cannot cure their problem. That's first and foremost. What we can do is be the resource and be the one that's there for them in their worst time of need. And that's what nurses do, right? So 580,466 people were homeless on any given night in 2020. Now we have COVID. We have already people that from the housing boom in 2008 to 2011, these people haven't even recovered from what's out there. So, and they're trying to get their lives in order. All the people that lost their homes, what do we think is going to end up happening with this influx of money being given out, right? I'm not complaining, but here's the thing. There's going to be a lot of people that have been in some moratorium or whatever it's called, where they are not able to be evicted and they haven't been able to pay their bills. They have not been able to take care of themselves, and they've been hanging on waiting for stimulus checks. What's going to happen when we have this, like, now real the people that are in their homes, they're losing their homes? What's going to end up happening again? It's going to be a repeat of 2008 to 2011, where we had all those people that lost their homes and tons of houses, almost another housing bubble, right? Just on a different scale. We already had a hurting society. We already had nurses and healthcare workers that had no idea. They knew mental health was something, but there's a heavy stigma, because even though that nurses are seeing this, they're experiencing it for themselves, but they don't want to say anything. So they're having burnout and PTSD and monstrous levels right now. And it's because of all of the things that we have been working through. Okay. With COVID, we have administration, we have patients beating up, nurses and frontline healthcare staff. We have massive shortage. Why is there a shortage of nurses? Well, we can get into that in another future presentation, which and that's another part of our behavior prevention program, where you will see the full spectrum of how to prevent violence in healthcare. It isn't about some crazy move. And that will come in handy with some patients that are psychotic and attacking you, but not every patient that has mental illness is going to attack you. And so what I wanted to tell you is that, do you think that these patients that are homeless, do you think these patients that we're dealing or working with COVID, do you think that they possibly have some kind of a mental illness that is happening? Yeah, absolutely. How about all the nurses with COVID trauma that are working with these patients and seeing like mountain loads of people that are dying, like on their in their career, and they don't know how to express it, right? So when we have this homelessness in America, we need to, this is just a portion of what I'm trying to explain, that is a huge problem, and it's only going to get worse. And I hope it doesn't, but this is something that we have to prepare right now for, because we have nurses right now leaving the bedside. They don't want to deal with what's out there anymore. They are trying to deal with things with what's happening in their own life. They're hurting. And then you have CNAs that are our front line, right? They get the full brunt of everything. So we have this breakdown of what we're looking at. So there is an increase, a 2% increase from 2019. It is steadily getting higher. With this, what is about to happen with our economy and everything else, it's going to get even higher than that. 2% higher than 2019. Now, I haven't even gotten into the opioid epidemic. I haven't even gotten into any kind of numbers like that, because number one is they're hard to find, because there's so many people. We've had an opioid epidemic for what, 20 years, maybe 15, 20 years. And why don't we still have these things in place? Why do we have to have a doctor's order? Why are nursing schools teaching this? Because it's going to keep our nursing students safe. And the nursing students are going to keep this out in practice because they don't want to get hurt, right? So we have the breakdown, 2% higher in 2019. I can't even imagine how it's going to be in 2021 and 2022. Not trying to be doom and gloom. I am the type person where I'm being very real, and I want to make sure that people understand that if we do not prepare right now, our nursing field is going to just be in shambles. And we cannot get nurses anywhere else, because every country is going through the same thing. It is World War III that our nursing staff is going through right now. World War III, with busted PPE, with no PPE, and nobody will listen to them. And they're just left with, okay, here's some money, bye. You can't do that. So this is what's coming, and this is what we have right now. What is coming? I want you to please use your critical thinking with this, okay? Breakdown. Right now, 39% overall individuals and families have been unsheltered. 36.1% are individuals and 2.9% are families. There was a little girl, I did a presentation at a school, and I always do like bullying, because I was the victim of bullying when I was a kid. And when I had met this little girl and I told her my story, her whole class, I did it probably to 10 different classes, told them where I came from, where I'm at, and where I'm going. And of course, this is a few years ago. She came to me, and this is in Pinellas County, and said, my mom and dad and I have been living out of a car. This is like 2 to 3 years ago. Okay. I hope that, and I was like, can I please, is it okay? Like, would you be okay? And I asked the teacher, I was like, if you want to give me a hug, I would really love for you to give me a hug, because I was homeless as a kid. I understand what's about to happen is not okay for even our children, much less what is coming for adults. And these adults are trying to be okay for their children. Now, what about nurses and doctors and everybody that is working in healthcare right now? How do you think that they feel going home and they're not okay? I'm not saying that what this education is going to be the solution of end all, but what I'm saying is that it will definitely help. Okay. 61% of the individuals that were homeless in America were sheltered. 34% were individuals and 26.7 were families. So that is definitely an improvement. These are statistics that just came out in January. So we have some statistics that I had to grab from before because they're not out. I don't know if it's because of COVID. I don't know why. But I am going to say that in 2010, I mentioned the housing bubble. Now, with severe mental illness, this is just a snapshot. Okay. This is a very old snapshot. Severe mental illness. Okay. That's schizophrenia. That's like, these are people that are not treated. These are people that are self-medicating. These are people that are homeless, right? Because, or even they could even be a felon, right? We're not there to judge, right? So 26.2% of those folks were sheltered homeless, had severe mental illness. That is your untreated schizophrenia. That could even be our war vets, right? Some of our war vets have severe mental illness that are like have PTSD that you can't even go like that. And they're like, it's bad, right? So, it's a problem. And then we have 34.7% of those folks, sheltered homeless adults, had chronic substance abuse. What is chronic substance abuse? Well, we were talking about opioids. We're talking about alcohol. Sometimes those go together. Well, what do you do when you have that? You also have nicotine use disorder. You also have, and then all of these different things and these stressors, as we've talked about in several different webinars prior to this, that epigenetics, once you open up that vault to Pandora's box, you're going to find that you're going to have a lot of folks that are going to start to see like hereditary factors. They're going to start to experience more of a mental illness. Like some things are going to be triggered and start coming up, right? In January 2015, 564,708 in any given night were homeless. This is in January of 2015. Now, I'm not a mathematician, but I'm going to guess that is about 6 years ago. I could save a life, but I'm not a good math person. 140,000, over 140,000 serious mental illness of that number, and 250,000 on any mental illness. That means that could be depression. And I'm not saying that is minor. Okay, that's pretty severe. Anybody that's going through any kind of mental use has to understand that we as healthcare workers, we have to stand not only with ourselves, what we're going through, but we also need to know that other people are going through the same thing. Sometimes we don't see things like that. Sometimes we're like task oriented. We got to do this, 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 and this. Okay, well, you need to lay down because I need to take care of this right now. Well, we really try not to talk like that. But there's sometimes we have to make sure that we're taking care of this patient right now because we don't have time. And we tell the patient, I'm so sorry, but we don't have enough manpower in order to be able to take care of the 10 patients that we have. Now, digressing a little bit, how about all the nurses that are taking care of med surg that got the in-service to take care of like 10 plus vented patients? How about that PTSD? How about all the things that nurses are going through in order to be able to fulfill their job, put in places of very dangerous situations and bad situations where they're seeing somebody that's not doing very well, and for some reason, nobody will listen to them, and this person dies. How about that? That's not okay. So we have the wounded soldiers that are coming back from war. They're out there, getting saving our country, right? Protecting us. But we have the healthcare workers that were even on the front line in wartime, trying to save patients on a nonstop basis. They're trying to attack the folks, the military guys and women. And we have the healthcare workers that are trying to revive people. So how is that not regarded as being important. If you ask any healthcare workers, they'll agree with me. The mental health of healthcare workers is not good. And number two, it has been highly disregarded. So there's a couple videos that I wanted to talk to you about to zone in a little bit more on opioid and alcohol withdrawal. So I'm going to show a video and then we're going to talk about it real quick. It's very short. If I can get it. All right, so let's see if I can get this. All right. Okay, so what I wanted to show you guys with this video in particular, so we have this patient that is having, like, she has an addiction problem. She is very much needs alcohol. She's hiding it. She's doing whatever she can in order to be able to be okay. Now, let's back up a little bit and I'm going to just kind of show you her appearance. Okay, so when you have somebody that is addicted to alcohol, they're going to have poor sleeping patterns. Okay, this person has a reddish appearance to her face. This will also be with males. As far as the dark skinned, complected folks, they might be a little bit darker. They might have a little bit of yellow in their sclera. Now, some of these things that I'm telling you, you're probably like, yeah, here we go. But how are we assessing this person that was asleep in the emergency room? How are we assessing this patient when they get up? Do we need a doctor's order to be able to recognize the signs and symptoms of withdrawal? Now, my nursing students will tell you, oh my gosh, Dr. Sandy is like absolutely ridiculous when it comes to, alcohol withdrawals and stuff like that. The reason why? Because I want my students to be safe. Not saying that any other nursing instructor does not, but if I'm not doing this, then I don't feel like I'm doing a good enough job for myself. And plus, especially for the patient, one of the things that you need to worry about when you suspect that somebody, even just by looking at them, I'm not saying to profile somebody, I'm saying just keep an eye on a patient that you have. This patient, if they had a history, it might not be a history, it might be still happening right now. So if this patient is coming to you, they have like shakes, like this lady, if you look at her, and I know that the video probably was not showing, let's look at her, the way that she's shaking. Okay, so you can see that in certain kind of movements, when you're looking at her hands, like she can't, like her hands will always shake. They're just like that, right? That could also look like Parkinsonism. This lady's probably about 45 years old. Do you think that she's going to have Parkinson's at this age? Possibly not. So these are things that we need to look for when it comes in that, the facial expressions. That is a part of it as well sometimes. Now, when you have somebody that is, when you have a protocol called SIWA, CEWA is a very good protocol to have. Now, if you can get a printed copy, I will provide a printed copy if you want. It is the main things that you need to look for. Now, I've already told you about the physical appearance, right? This person might have a distended belly. This person, they have a high risk for GI upset, pancreatitis, gastritis, anything like that. And they have a high incidence of possibly having a GI bleed. So these people might have to have, they might even have a high incidence of having, and you can't really tell until after, but the GI bleed could be probably from portal hypertension. Not necessarily like their blood pressure is super high, but if they've got all these factors, they smoke, they drink, they're pretty much partiers that haven't grown up from, teenage years, which that's still really not that good. But this person is not doing good. They're not recognizing that they're sick and they could possibly have a GI bleed. They're not even caring about that. Do you think that somebody cares about if they need, how they're going to get their next fix? No. As my experienced nurses that are out that are probably listening to this are probably like, yeah, that's all that they want. They just want the drugs. Well, guess what? We're not there to heal them. What we are there to take care of what they need, right? We're not there to heal their drug addiction is what I'm saying. We're there to take care of their needs and and to love them where they're at and to ship them on and give them the resources that they need. So one day, hopefully they will take those resources and get better because if they have children, they need their parents, correct? Yes, absolutely. So we have this female that's hiding liquor. I'm going to show you the rest of the video. So the things with the CEWA, let me back up. With the CEWA protocol, you don't need a doctor's order. You're not prescribing anything. It is easily put into your health assessment. When you're going through the head to toe assessment, you're looking at shakes, right? You're already looking at shakes. You're going to be looking at the cranial nerves, right? If you see this person that's like doing like this young lady, you're going to have her hold out her hands and then spread her fingers and then watch and see if she's having any kind of tremors. Sometimes people just make it up. And you know what? And that's okay because you know what? Again, we're not going to cure them. What we could do is we can help give them medications to help them feel better until they get discharged. We're not trying to be the judge and jury here. We are trying to make sure that our patient is taken care of because if this person seizes, they will go right to ICU and they could die. And if you miss this is a huge problem. So when you have somebody that is severely addicted, right? They're not going to be okay. You're going to need to make sure that you intervene. And that person missed is another person that could be a near miss. This person could die. So when you're doing you're looking for tremors. Now, if you find that they're like this, what I immediately do is I go right to my head to toe, right? Because you don't have to go literally head to toe all the time, right? You can do a focus assessment. So when you're sitting here and you're looking at your patient, okay, and they're shaking, check that out, right? Watch their gait. How are they shaking going to the bathroom? What is happening? I understand you're busy, but you know what? This is going to save you not only a person that's going to die on your shift, but it's also going to save you from getting punched and bit or whatever is going to happen, as well as also going to save their life. Don't you that's what we are here for. That's what we do. And if we miss that, it is a huge near miss. So watch and see as soon as they're trembling and you're seeing all of this stuff, right? Head to toe, start from their head. Okay. Feel their, whatever you do with your head to toe assessment, check the tongue, whatever you have to do, check the tongue and don't be obvious. Okay. Because the word gets around. Okay. You're going to have them stick their tongue out, right? And then their tongue, if they're really having a tremor, you'll see it it'll be so thin. They can't even do the dirty, nasty thing with their tongue. They can't. There's no way that they can do it that fine and make it up. So you're going to have them stick out their tongue and then you're going to just continue on and then you're going to finish out your assessment, right? If they don't let you do their assessment, rightly so, because they're probably addicted. So what you want to do, if you're finding that their tongue is shaking, do they have Parkinson's? Do they have any kind of, motor activity issue? Okay, so they don't. Okay, so you see that they might be an alcoholic, or you smell it on them. So what kind of alcohol do you drink? You start right into your cage assessment. What kind of alcohol do you drink? How much do you drink? What is your favorite drink? And they might be like, tequila sunrise. I like about 10 of them, and so how much tequila do you put in there? And then just, if you have a normal conversation with somebody, don't say, oh yeah, I'm going home and I'm going to have me a drink. That's not good, guys. I know there are a lot of healthcare workers out there that are drinking, but I need you to understand this is about the patient. And then when we understand more about the patient, we'll start to look at within ourselves and be like, you know what? I need to either talk to Dr. Sandy, or I need to talk to my friend, and we need to just get ourselves okay. And that's what I want. I don't want it. I'm not charging people for anything. All I want to do is get my community better. And that's what we're trying to do with Nurses Against Violence. So here we go. You're going to do the tremors, right? Go immediately to the head. Then the main key things. Yes, if somebody goes out drinking and they're having a blast at, partying, they're going to vomit maybe once or twice. Okay. That's the way it is with alcohol. They might vomit a little bit more if they drink too much. Now, when somebody is withdrawing, do you have functional alcoholics? People that look like normal, that don't have a ruddy appearance, that are just like you, me, that look like me, right? They go to work, they could be functional, they could be drinking all the time, and they could have a very high blood alcohol level. Labs that you're going to be looking for, blood alcohol level. You're also going to be looking for ammonia. If you suspect that somebody has a distended belly, you're going to be looking for all of that as well. Some other things that you're going to be looking for is when you have somebody that has been drinking a lot, they're going to have a lot of vitamin deficiencies, a lot, like B12. There's several different ones, and we can get into that another time. So your head to toe assessment after you do the tremors, while you're having this cognitive conversation with somebody, with this person, they're going to be like, you're going to start seeing them be like, I feel like there's things crawling all over me, or, they'll hearing, seeing, and feeling things that are not there. Mr. Smith is my go-to. Mr. Smith, are you hearing, seeing, or feeling anything that's not there? Like any kind of bugs, feeling like anything tickling on your body? No, not at all. Okay. Well, if you do, will you please let me know? Yes. When was your last drink? Don't make it a problem, make it very easy, laid back, because you know what? This person might be somebody that used to hang out with years prior to meeting them today. Right. So you don't want to make them feel uncomfortable, because they won't tell you anything. And then there you go again. You're right back on the spiral. Mr. Smith, are you hearing, seeing, or feeling anything that's not there? No. Okay. Will you please let me know if you do? Yeah, sure. I don't care. That's fine. You're going to be looking out for tremors. You're going to be looking at their gait. You're going to be looking at, things that is going. You're also going to keep an eye on their guests, because guests like to bring in things as well. So I'm going to just show you this video again, just a little bit longer. Okay, so when we have this female that is having these issues, right? We need to remember something. This person is a mom this person is a sister, this person is an aunt. We have to remember that they are they're a human being. They're not trying to get drunk to be cool anymore. They're not trying to get they're not trying to get drunk just to let the day go by. They're trying to survive. And this is an inner pain. This pain is deep, and there's something that has not been has not been remedied. And they're either their childhood, things that's going on in their life, and they might not have somebody to talk to. So when somebody reaches out to you, if you don't have the time to talk to them, please find them a resource, a pastor, somebody that will be there to be able to talk to them. And every floor should have some kind of a mental health person that could just sit there and do you could even sit there and do your charting. The closer you keep people, the less problems you have. So let me show you one more little video, and we're going to talk about cows right quick. And yes, I know that Southern's coming out in me. So I'm going to show you this video. I'm absolutely loving this because it was students that put this together. It's about 7 minutes, and then we'll briefly talk about cows and how that applies. Same kind of thing. You want to be very cool with your patients. You do not want them to feel like they're put on, that they have to say you're not their boss. Okay. One thing I want to back up. So you have alcohol, the same kind of withdrawal. If somebody has been addicted to Ativan or any kind of benzo, okay, but benzodiazepine. If you have somebody that is withdrawing from benzos or withdrawing from alcohol, you do the CEWA protocol to make sure that those active symptoms are not there. This is a scoring system. So when you have somebody that is having these kind of withdrawals or having massive shakes, this person will be on a scoring system, and you'll see it when you see the scoring sheet. With alcohol again and benzos, okay? Are you hearing, seeing, or feeling anything that's not there? And then, how much do you drink? How much do you take, right? How many pills do you take? What pills do you use? How do you use them? Things like that. Same kind of idea too when we get to doing the opioid withdrawal. Yes, I understand there's a misspelling, but I am so happy that a school did something like this. So let me share my screen. I'm not very technology based, guys, so please just humor me. All right. Now you're going to see the behavior that we see a lot on the floors, and this is not acceptable. And nursing students are learning this. Okay, so I have to back up because this needs to be called out. If somebody acts like this and you're getting a patient from them, how has that patient been cared for that whole entire shift? This is what you're going to be getting. You're going to be getting this patient that's had this their entire shift. So I want to make sure that everybody understands, be careful, because the way that we treat people doesn't necessarily have to come out of our mouth. It could be exactly what their actions. We need to be extremely careful Because when you have somebody that's withdrawing, Pam, Pam, bam, whatever it is, they're going to come after you because guys, you might not agree with me, but if you look at the way that everything has been, you'll see that I am pretty accurate with this. So when you have a patient that has had somebody that's ignored them, that has this mental thought, where did the student get this from? Where did the student get this behavior from? Think about that. This is a student. So I'll leave you at that and let you finish. Wow. I have to stop right here. Now, not everything that this nursing student is going to be perfect, okay? So please be nice in your responses. When we have this patient that is withdrawing or has been taking a lot of different kinds of things to help with their pain, right? Because they do have pain. And we have no business saying that they don't have pain. If they have been using like any kind of drugs, hardcore drugs, do you think ibuprofen or Tylenol is going to help this patient? No. Anybody that you know that is going to, not but people that you have, they're going to have lower back pain, right? That is a huge common side effect. Okay. Some other things that you're going to look for with this patient, you're going to be coming in and you're going to be looking for track marks. They look like scars and lines, right? If they're active, they'll almost look like henna tattoos. If they have henna tattoos, I would be paying close attention, looking for abscesses. Mrs. Smith, is there any open areas that I should be concerned about? Because you want to make sure that we're caring for you. Soften your face, okay? Soften the way that you're talking. I'm very loud as it is, and people people love me, I guess. I don't know, but I'll be on the floor and somebody will be talking with me and I'll be like, hey, what's going on? Do you have any like open areas or anything that I should be aware of? And of course I'm going to be assessing them. But sometimes when you have somebody that is actively withdrawing, they don't want you to touch them. And that is very important because if you're touching somebody, even if you have to listen to their lungs, you can come back. Same principle as an Alzheimer's patient. If you have somebody that doesn't want you to touch them, you come back and reapproach. You do not have to force your task on this patient because you know what? In some states, it could be considered as an assault. Okay. You need to be very careful on what you're doing. And if you're a male that's working with patients that you're not sure about, you need to have a witness. You need to have a female with you. Okay. And vice versa, females. If you don't feel comfortable with the male that is flashing his, whatever, you need to have another person with you, male or female. It is okay. And if they do not want to help you, then you find somebody like a supervisor that will, and they will have to answer to them because it's your safety that's very important here and it's vital. because you're the caregiver to those patients, and those other nurses, they don't want to be taking up your patients. They don't want your patients because they got enough work to do. So I would imagine most floors would want to have a teamwork approach. So never be afraid to ask, especially if you feel like your safety is in jeopardy. So I'm going to continue on. See how this patient and this nurse are starting to connect. Okay. That connection is not there anymore. Connection is not in healthcare. Connection and relationships are not even around, period. We have to fix this. Okay, so I want to tell you a little bit about what is going on right here. So when you have somebody that's withdrawing from opioids, whether it be heroin, you want to find out how many bags that they're using, right? You want to ask them, like, tell me a little bit more about what you're using, where you got it from. They're mixing it with fentanyl now. There's some pretty hardcore withdrawals that are happening right now that these people have to go to the hospital. With opioids, what do opioids normally do? They bound people up, correct? They get, like, their belly will be hard. They'll be full of, what, right? So you want to listen to their belly. You want to, the best you can. You want to ask them when's the last time they pooped. I never say BM because they're like, what? When's the last time you pooped? What did it look like? What did it smell like? Was it hard? Was it soft? Sometimes they'll laugh. I always try to make them laugh somehow. And what, you know, tell me a little bit more about the nausea and vomiting. So it is very important to find out, because once they stop taking these opioids that continuously bound them up, they are very much a high risk for having a small bowel obstruction, right? So you want to make sure you're listening to the bowels. There's different labs and stuff like that too. There's a CALS protocol, which will also provide, and there's a scoring system. One of them is the pulse rate, right? Because, they might even be running a temperature, right? Even with the other one. But the biggest signs and symptoms with the alcohol withdrawal is, are you hearing, seeing, or feeling anything that's not there? And the tremors. Those are the biggest things with alcohol and benzos. With opioids, they're going to present as having the flu, right? Or having some kind of congestion. So when they're constantly, right, like all the fluids are starting to work and they're vomiting, they might even get dehydrated, vomiting, diarrhea, right? Those are important. Those are biggies with this. So they're going to present like having a GI bug is the way I describe it, as well as having upper respiratory, like congestion slash, junk, we'll just say. So they're going to be draining out their nose. They're just like fluids so you want to make sure they stay hydrated. So the Gatorade or something that they have on the unit is very important. So when you have somebody that you're assessing, you want to make sure that you're getting especially the opioids, the pulse. Are they vomiting? Are they having any diarrhea? How many times have they gone? As well as also, that's like the biggest thing. So they look like they have a GI bug and they have like some sort of flu because they also have body aches, right? So they'll be running a temperature and there's, they'll be running a temperature or they'll be like, sweating. Actually, they're not going to be running a temperature. Sorry. They're going to be sweating so profusely that like they'll be changing their clothes or gown like nonstop. It'll be so nasty, right? Covered in sweat, but they're not running a fever. That's what I meant to say. They're not running a fever. They're not running a fever. You're seeing all these lines on their hands and between their fingers and between their toes. You want to seem very comfortable with them in order to be able to get some more information from them to take care of them, because we're not going to heal them within the 3 days that they're going to be with us. We are there to take care of them, to make sure that they're getting the care that they deserve, just like we deserve them to be safe with us, right? So I'm going to resume this, and that way you get a better idea too. Trust issues is a big thing. You want to build that trust, that communication, and that relationship fast. Okay, so I'm going to just fast forward this. So she's just getting an order. I just love this video. They did such a great job. All right, so 1 hour later. I just want to let you know, I mentioned that she doesn't do everything the correct way. We want to be able to hold our patients' hands and to be able to, touch them. A lot of people that are withdrawing and that have like things that they have not resolved in their mind, you don't want to necessarily go up to them and touch them. You can ask permission. Can I, is it okay if I just put my, hand on you? But again, be careful, because this person might turn that around on you. And she is wearing her stethoscope around her neck, which could be used as a strangulation device. So my kudos out to these guys at the university. I'm so proud of them for doing that video, because it's not easy to have like to do a scenario like that, but they were so good. That's probably, there's not very many out there, so we plan on trying to get some of those put together for our program, to help people understand a little bit more. Maybe I'll be an actress. I've always wanted to be somewhat of an actress, so but I wanted to make sure that you understand the fundamental thing that we need to understand. This person is hurting. We have a community out there. We have nurses, we have CNAs that are also hurting. When you come to a patient that's hurting and you have two people hurting, it doesn't do this, right? We have to be okay. And my hope and prayer for us as a nursing healthcare community and organization is that we are there for each other. So I want to thank you from the bottom of my heart for you. And if you have any questions, I'm here for you. You can reach me at Dr. Sandy, and then at nursesagainstviolence.org. That is my email. I appreciate your time and thank you very much. If you have any questions, please feel free to reach out to me, and let's just get out there and let's try to do the best we can and help many. Thank you.